everyone. Welcome to Senior Circuit. Thank you so much for joining me. This month, we have Somerville Prevention Services with us, Matthew Mitchell and Kira Vaughn. We're so happy to have them and hear about their programs and what they've been up to over the past few years here in the city. And I'm going to turn it over to Matt. Thank you for being here.
Thank you, Ashley. We appreciate you extending the invite to have us on the show. So again, my name is Matt Mitchell. I'm the Prevention Services Manager with the City of Somerville's Health and Human Services Department. And my role is I oversee all of our programs and initiatives around substance misuse prevention in the city. So that focuses on alcohol, tobacco, nicotine, marijuana, opioids, a couple other things too, with a particular focus on youth, but for the community at wide.
Great. And you also have Kira joining us today. Welcome, Kira.
Hi, so nice to be here. Thank you again so much for having us. My name is Kira Vaughn. I am the Substance Use Prevention Coordinator for the City of Somerville. I'm a licensed mental health clinician, and my role is to both provide clinical support to Somerville Public School students in terms of students who have been struggling either with substance use or have questions around substance use in terms of more of a health-related manner. And my other part of my job is also to provide community education, prevention trainings, and to kind of assist Matt with a bunch of other substance misuse prevention efforts throughout the city.
It sounds like you have big roles to cover and quite a mouthful of titles. Why don't you explain to people what exactly prevention means and what exactly misuse when it comes to substance uses may mean for people?
Sure. So it's a common question we get often because people assume our work is around like treatment, at the point where someone may be using a substance and need help. That's actually a little bit different from what prevention is. Prevention is actually trying to educate and inform the community before even considering use or before being put in a situation where they may be experiencing a substance. So the prevention is really meant to be the education portion of substance use, where we are doing virtual trainings or where we're connecting with youth and connecting with different people in the society, in our community, to learn more about it so that they can make informed decisions later on about whether or not they want to choose to use a substance or how to use a substance to reduce their harm and risk associated with it. So that's the first part of the question in terms of prevention. And then for misuse, it's more of like when use starts to impact other parts of your life in a way that maybe is not ideal. So, there are certain substances that are legal that we review and we educate people on about, and there are others that are not legal. And so for the substances that are legal, we like to talk about how you use those substances safely or in a way that's not going to lead to any type of harm to yourself, whether it be physically or emotionally or mentally or whatever that may look like. But we do focus a lot on like that shift from when it goes from just use to misuse and how there's so many consequences that can impact someone's life.
Right. I think that's a really important point to make because a lot of us kind of look at that as black and white, as either using a substance correctly or as a doctor ordered, and then people who have an addiction and maybe need an inpatient treatment or something in that regard. But there's this whole system in the middle. And that's what it sounds like you're saying is really where people may fall into a misuse category and may need some warning signs or some more conversation about things to look out for. And that's what it sounds like your education programs really are all about.
100%. And I think there's an assumption or a stigma that all substance use is like chaotic and that like, if you use a substance, you must be in some treatment program or something like that. And there's certainly a time and a place for that, and particularly for individuals that may be seeing some of those consequences I mentioned earlier. But there are other parts of that I think people don't necessarily fall into that, but still have to know important information about. So that's where we kind of like fall in the world of substance use.
Absolutely. And Kira, I can imagine there's so many things and many topics to talk about. What are some current prevention services or programs that you have right now?
So I would say we are doing things kind of on a multitude of different levels. I'll let Matt speak about some of the ones that he is particularly proud of, but I would say in terms of what my role is bringing to the city and to the community, for instance. So again, like I said, I do direct one-on-one assessments, basically meaning I'm sitting down with the student and I'm kind of seeing, well, what is going on? Are you someone who is misusing substances? Was this kind of more of like a one-time experimental use? Is this something that you actually want to get more education and awareness around because you have questions about it? You're not sure whether something is safe or unsafe. So my role is to really work with the students directly one-on-one at that level. And I think a lot of the other work that we are doing has been very virtual, obviously, in the past year. I actually only started a few months before the pandemic and shutdown happened. So we've been doing a lot of community level virtual trainings, which are actually up on our YouTube page now, and we are advertising those on our social media constantly. We have done trainings on everything from kind of introductory presentations about like, well, what is marijuana, or like what is, what is a stimulant, type substance. And also even things like anger management and substance use, or mental health and substance use. So we're really trying to break down a lot of the stereotypes and stigmas, as you mentioned yourself just a few minutes ago, and just trying to put as much helpful information into the community as possible that's actually realistic, medically sound information in a way that's actually understandable to anyone who has questions about it.
That's great. And I can imagine with the virtual programming that you really get to target the whole family and not just the student, but the parents and the grandparents, because substance use is out there and it's not just affecting the individual. It really does touch all different facets. And I know that Matt will continue to explain some different programs that he's particularly involved in, but you mentioned that you get a lot of referrals of school-age children or high school-age children. And where are you getting the referrals from? Is it from parents and grandparents, or from the school, or a self-referral process?
That's an interesting question. I would say the majority of the time when I've gotten referrals in the past year plus, it's predominantly been from the schools, but second place, a very close runner-up would definitely be concerned parents, caregivers, and guardians. I have had a few students who have come to seek me out just knowing that I was available in the building. At one point, again, before the pandemic, I was actually kind of doing walk-in type situations up at the high school where I would sit next to the nurse's office, and if someone had a question for me that was, again, more of a health-related issue around substance use, they could come and find me. We would have a totally confidential conversation around it. But I would say the majority of who I'm hearing from first would definitely be concerned counselors, teachers, other school administrators, and then definitely, again, parents and caregivers.
That's great. So very comprehensive. And I'll turn it over to you, Matt, to talk a little bit more about the programs that you're running.
Oh, thank you. Yeah. So if I had all the time in the world, I'd probably talk all day about the prevention programs we're doing. But I tried to highlight 3 here that I think are particularly of an importance for our seniors. And I think the important thing that we kind of like to put out there first off is that as much as we focus on youth, we know that a lot of caregivers are not just their biological parents, but also their grandparents. And we feel like there's a wealth of information that maybe seniors maybe they know a little bit, but we want to kind of broaden the scope of our work to not just be on youth, but to be the full spectrum, as you kind of alluded to, Ashley. So for the programs, particularly for seniors, I think the biggest thing that we like to focus on is the Prescription Drug Takeback Day, which is typically held in April and October of each year. So we actually have one coming up next month. And the understanding or the basis of this program is so that we really are trying to discourage individuals from having large amounts of opioids in their house. So for seniors, 65 plus, they account for a large amount of the opioids that are out there right now because they're getting them prescribed by their doctor or physician. And, as we've learned with the opioid epidemic over the last decade plus, it's been many different paths to which people have kind of used substances. So
being introduced to them.
Right, exactly. So there's like heroin, where I think a lot of people think like, oh, it's using it with a needle or a syringe. But then a lot of other individuals have been introduced to opioids through the doctor, and obviously not for their, not because they wanted to, but because they had a shoulder surgery and then they had these other consequences that we just fully didn't really understand at the time. So this is a national effort, and we work with like the DEA, for example, who sponsors the event, to make sure that individuals know that on these certain days you can take your prescription drugs, the unused or expired, to these drop-off locations to get them out of your house. So it's minimizing the access to maybe someone who's using and wanting to find the substances, or youth by accident having them in like a medicine cabinet or whatever. So these two events are really meant to help people get the medications out of their house, but it's not just those 2 days that it's available. It's available 24/7 throughout the year. So there's a kiosk available at the Somerville Public Safety Building, or the police station, at 220 Washington Street. And right in the lobby, you'll see it kind of right near the information desk. There's 2 kiosks. One of them is for pills and one of them is for syringes. And that way, you could do it 24/7, no questions asked. No one's going to ask you what you're doing or anything like that. It's just a place that we know is open to someone whenever you want to give them back. Yeah. So that's available. It's pretty simple, where if you have like a pill bottle, all you have to do is scratch out your name, leave the medication, but scratch out your name and throw it into the bin. If it's a liquid, you actually don't dispose of it there. You actually dispose of it at home. So just pour it into like a little Ziploc baggie, maybe mixed with like some kitty litter or coffee, something that wouldn't be very, great to digest. And then you can just throw that in your trash. And then if it's a syringe, just put it in like a bottle that's kind of like plastic or safe. So if it's like a detergent bottle, like an old detergent bottle, or like
or milk carton, even
milk carton, perfect example. You can throw them in there, seal it, and then throw it into the kiosk. And it's very simple, very easy, and it's something that I think we want to make as easy as possible for people.
Yeah, I think that's great to remind everybody, because we do have a lot of seniors asking us, where can we get rid of these old prescriptions? Or I don't want anybody to be jabbed by the needle if they have diabetes. But I think it's also important, like you mentioned, with the extra prescriptions lying around, and just where prevention can really play a key role, because we hear so many seniors saying that maybe they did break a bone and now they're afraid to take the pain medication, or maybe they rely on it too much, and how prevention is really just learning sometimes how to talk with your doctor, and how can you take maybe medication that you need safely in a safe manner. So I see your programs all across the board, and I jumped right in, and you said you had 3 programs, and I know you only got to 1. So take it away, Matt.
I'll get to the other 2. And I think we have a little bit more to say on that later on too, about talking with your doctor. Because that conversation is not as easy, I think, as people think sometimes. But one of the bigger grants that we're working on, it's called the Overdose Data to Action Grant, otherwise known as OD2A. And it's really aimed at helping individuals who are experiencing homelessness and or housing instability, on educating them on overdose prevention. So there's this wealth of knowledge that I think a lot of people don't know about, of you can treat an overdose like a medical emergency, because it is a medical emergency. And, we talk a lot about like the stigma around, like, if someone was experiencing a heart attack, a lot of people would just jump right in without any questions asked. But if they think that substance use may be at play, they're maybe a little bit hesitant to do so. So part of this training is actually allowing people to understand, recognize, and efficiently respond to a potential overdose in the community, because time is of the essence. If you are able to recognize the signs and symptoms, or, the warning signs, getting someone 911 help immediately it's literally minutes sometimes that matter. And so we partnered with Fenway Health and the Somerville Homeless Coalition to provide these trainings to the people that they serve. So to date, we're about a year-ish in.
Year and a half, almost.
Year and a half, maybe. Yeah. We've trained over 35 people, and it's only growing, because people are not only receiving the training, but they're also receiving some care items. So they're getting these durable backpacks with like baby wipes, foot powder, blankets, a lot of care items that people want, especially if they're experiencing homelessness or instability. And we liked that population particularly because we had to pick kind of who we wanted to focus on. And we felt like that was a broad population that we could really delve into, because a lot of people experience instability, and that doesn't have to look like you're homeless. That could mean transitioning between apartments or transitioning between housing or whatever that may look like. So it's been great, and we keep that going. So if anybody here has anyone that may be interested in receiving that training, or like an agency that supports the individuals that we're talking about, let me know, reach out to me. I think we'll talk about my contact information later, and we'll get those people trained, and we'll get them some of the items that they need. My last one is our youth programming. So again, we do a lot of youth programming, particularly trying to educate youth at a young age about substance misuse prevention. And so, there's the adage of like, how young is too young? And we're kind of getting at like, start early, as early as reasonably possible. I think we start in 6th grade with some of our programming, but it's better to have the information early on than have it later on and have them have to be forced with, I don't know what I should do here. So we recruit every year anywhere between 20 to 30 youth between middle school and high school. And lovely Heller Botari, who's our SCAP program director, she oversees the programming, and they do substance use prevention efforts. So this year, our focus was actually on a photo voice project. So it was a problem gambling photo voice project where the youth took a curriculum. It was in partnership with the Massachusetts Department of Public Health's Office of Problem Gambling Services. That's a mouthful. As well as Cambridge Health Alliance. And the youth received this training. They went through the curriculum, they took pictures, and then it was featured in a virtual exhibit this past January. And it was great. We had 12 youth or 11 youth participate. And now we actually have their pictures displayed throughout the community. So we have a virtual platform where it's on our Instagram and our Facebook pages, but it's also at the Connection Building. For those who don't know, it's in East Somerville, and it's going to be traveling around to different locations in the city. So if you happen to be out, we don't encourage anybody to be gathering anywhere, but if you happen to be in the area, you can see it for the rest of March. And then we have some other places that will let people know we'll be featuring it for the next couple of months.
Yeah, exactly. Great. And also really showing that you guys are expanding from substance use prevention into prevention of all sorts with problem gambling. Really great. And so not only expanding programming, but also expanding, it sounds like, the ages that you're trying to target and the populations. And while all their needs really vary, what can you kind of say to address to people, or if you even have one golden item of why are concentrating on substance abuse or misuse and concentrating on prevention? Why is it important? Why is it important here in Somerville?
I think I'll take over that question if you don't mind, Matt. I think honestly, the simplest answer, and this is something that Matt has said to me over and over and over again, prevention works. And not just in the sense that we know prevention efforts at an early age for a variety of different health interventions can be effective for the community, but also just because we also have a lot of data, frankly, to back up the changes with substance use in the community over the past, I'd say, going on now just over a decade. So for those of you who maybe are not super familiar with the school system, we have something called the Student Health Survey, which is administered to our middle school students and to our high school students kind of on a rotating basis every other year. And I actually was looking up some of the statistics earlier today for another thing I was working on. And from 2008 to 2018, there was a drop of reported current cigarette use from 50% of all students at the high school to just 3%, a year or two ago. And then alcohol use, that was even a more dramatic decrease, where again, 2008, 37% of all high school students were reporting alcohol use. Now, again, a year or two, it's dropped down to 17%. And I think this really coincides not just with us having the student health survey and trying to collect all of this information, but we've been doing more and more and more and more prevention efforts in the city in the past decade or so, in part because of the opioid epidemic and how much that has increased, unfortunately, in the last several years, but also just in terms of, again, wanting to really focus on youth health and bringing a lot more attention at much earlier ages. And we have the results literally in the numbers. I think that is definitely one of the big things that we want to talk about when it comes to prevention and its effectiveness.
Right.
Yeah, I agree. If I could jump in, the only other thing I would add would be not only do we ask about use, but we also ask about like perception of harm and perception of risk. And those are actually things that we like to track very closely because it kind of gives us a sense of like the community favors or not, whether of certain substances. And that's another one that I think we keep a close eye on because, as we've been seeing a lot of legalization efforts with different substances and a lot of decriminalization efforts with different substances, all of which we are certainly for, particularly because we are all about harm reduction, and any policy that supports harm reduction is a big one. And transitioning, substance use treatment away from the criminal system and more into the like healthcare system. And those perception of harm, perception of risk are a big factor of that because, when you hear things like legalization and everything, I think the adults sometimes struggle with understanding what that means, but imagine what that sounds like to a youth who's like, oh, does legality mean it's safe now to use? And it's like, no, it's not necessarily safe, but there's certain ways in which if you're of age or, you use in safe ways, then it can be something that is not going to be detrimental to your health. So, we really focus on like trying to get people to understand that legalization is important for those who are struggling right now and to get their treatment back to the healthcare system or to the healthcare system, but also important to note like the messaging and kind of balancing that for a youth perspective.
And I think that's why prevention is so important because when things are legal, such as alcohol, which has been legal for such a long time, that sometimes youth or even older adults think, well, this is legal. This makes it safe. And that's not always the case. It may be okay, but there's always a point where, it is impacting our lives or impacting how we're functioning, impacting how our families are functioning or the effects on our families. And I know we'll just kind of bring it back to before you folks had mentioned that you had a little bit more to say about how to talk to your doctor about pain medication and what to do, maybe two separate questions about what to do when you feel in yourself like maybe my gambling is affecting my life. Maybe my alcohol use is affecting my life. Maybe I'm hearing from different family members. What do I do in those situations?
I will also take on this question, and I'll try to say it succinctly. I actually spent several years working at various different community health centers and hospitals in Boston. And one of the biggest things I remember from my experience of that is because I was integrated kind of into the medical departments, I had so many clients come to me asking me all of these health-related questions, especially around pain management and opioid use. And I would always say to them, why aren't you asking your doctor about this? Why aren't you asking your surgeon about this or your primary care doctor about this? And almost universally, the answer is always, well, I feel stupid if I ask my doctor a question like that, or I don't want to like look like I'm really dumb and like, not informed about all of these things, and there's so much also stigma around pain medications as well. So honestly, the best advice that I can give is if you are comfortable doing so, there is no such thing as a bad question when it comes to talking with a doctor. Please have just an open, very honest conversation about what your concerns are. And I will say this much. If you don't have maybe a super great relationship with the medical provider who's prescribing you the script, talk to someone who you do trust, who has maybe that medical background. Say maybe you don't want to talk to the doctor, maybe talk to the doctor's nurse, or talk to, someone else who is maybe a case manager, or maybe ask for referral to a pain management clinic, because there are specific pain management groups out there that are trained to help people manage the symptoms of chronic pain and even temporary pain, through a lot of non-medication based interventions. It's really about advocating for yourself and what you feel most comfortable with. And then I think the second part of your question, Ashley, that was more focused on
resources,
right.
Again, I would always say if you are getting prescribed an opiate, always feel free to turn to your medical provider for assistance with navigating that. However, if you are someone who is struggling with prescription and you are looking for additional help, there are obviously a lot of different avenues that you can take. Obviously, if you are a senior, for instance, we always recommend please contact Ashley, our lovely Council on Aging team. If you are also perhaps, someone who's between the ages of 18 and 65, or you are in a situation where like the whole family maybe might need some assistance, you can also contact us here at Health and Human Services. We have several different coworkers who are case managers and also just social workers and therapists with the city. We can also do our best to assist you in that way. And then also, if you are someone who knows of a youth who was under 18, who maybe is still part of Somerville Public School systems, I am always accessible and reachable and happy to provide care. And I will mention just one final resource. If you feel like you are at the point where you are in serious need of an intervention and you actually feel like you need more formal type treatment, my best recommendation is always going to the Mass Helpline. The state has set up both a website and a hotline number, which I will say aloud here, 1-800-327-5050. It is a free hotline. You can contact them and they will assist you with finding different treatment programs in your area, what detoxes are available. The website is very easy to navigate and you can break it down into some very specific search criteria based on everything from your gender to your location. It's super, super convenient to use. So I highly recommend reaching out to them as well.
Yeah, I think you kind of really said it right in the beginning that there is help out there within the city, within your doctor's office, within the Mass Helpline, but you have to take that really hard first step and just ask the questions. And some people we know here at the Council on Aging, they like to write their questions down beforehand or give them, have them written down in their pocket. And some folks like to email their doctors now with the questions before, so the doctor's ready. So there's lots of ways if we can make that first step. And it's great to know the city has so many services available for all age groups. And I really thank you both for being here today, and thank you all for joining us on Senior Circuit.
Thank you.